In today's class, we will study the NSAIDs. Normally, we are calling as a NSAIDs. The NSAID means non-steroidal anti-inflammatory drugs. This is called NSAIDs. In short, it's called NSAIDs. Before we have to start this anti-inflammatory, first of all, we will study what is inflammation. The term here, the N for non-steroidal, it means that the drugs in this category or in these groups, the drugs which are having the without the steroidal ring. In these drugs, the steroidal ring is not present. Those drugs are coming under this NSAIDs. And anti-inflammatory drugs means anti means against inflammation. Before we have to start the anti-inflammatory drugs, first of all, briefly you will understood the what is mean by inflammation. Whenever due to the injury, it may be internal injury or it may be external injury or infection or some other reasons, the whenever our body is made up of cells, if the membrane is ruptured, the cell membrane is made up of phospholipid. That phospholipid is converted into arachidonic acid against the this any infection or any burn or any this type of things, the against that immune response, it is a arachidonic acid is produced. Here arachidonic acids, it convert into prostaglandin. This prostaglandin is produced with the help of the enzyme is called cyclooxygenase. The cyclooxygenase is, it is two types, COX1 and COX2. Cyclooxygenase 1, cyclooxygenase 2. The mainly predominantly the COX2 is producing prostaglandin. This is the prostaglandin is the main factor for the inflammation in the body. Okay, it means that the inflammation in that the symptoms arises the pain, warm or hotness or redness, loss of function and swelling. These type of the symptoms you can see whenever the inflammation is there. Okay, this is the method. In this method the inflammation is produced. Why? Whenever the person is suffering from pain or fever or heat or redness, loss of function, swelling, then for that we are using the drugs to reduce the pain, to reduce the heat or temperature. We are using the drugs, non-steroidal anti-inflammatory drugs, that is called NSAIDs. The NSAIDs are widely used medicines that produces anti-inflammatory actions, analgesic, antipyretic, sometimes antiplatelet actions. These drugs widely used medications for the inflammation against, just now I told, anti-inflammatory, analgesic as a painkillers, as a fever reducing agents, and for the platelet action, anti against the platelet actions. They are termed as a non-steroidal because they reduces the inflammation without corticosteroid pathway. So without the steroid it is there, that's why it is termed as a non-steroidal. Now the definition of the NSAIDs, definitions are the NSAIDs are the drugs that inhibit the cyclooxygenase enzyme, reduce the prostaglandin synthesis, produce anti-inflammatory, analgesic and antipyretic effect. What it means, the NSAIDs are the drugs inhibit the cyclooxygenase enzymes. You know, whenever in the mechanism of actions or mode of action, the cyclooxygenase the reduces, then it will not produce the prostaglandin. If the prostaglandin is not produced, the inflammation is not there. That's why as a NT, that's why NSAIDs are the drugs that inhibit the cyclooxygenase enzymes, reduce the prostaglandin. That prostaglandin synthesis produces the anti-inflammatory actions, analgesic, like reducing pain and fever also. This is about the NSAIDs. Next is the meaning of the important terms. Prostaglandin here. The prostaglandin is the mediator response for the pains. This is the main reason for the pain. Whenever the person is suffering from pain, fever, inflammation, gastric mucosal protection, this is the main mediator response is the prostaglandin. Okay. This is the prostaglandin. Next one, COX. COX convert arachidonic acid into prostaglandin. Just now we discussed the COX is converting this arachidonic acid into prostaglandin. And COX-1, it is a protect housekeeping functions of stomach, kidney, and platelet. It means that the COX-1 is a protecting housekeeping function. It is for the our stomach layer of the stomach's kidney and for platelet. Next, COX-2 is the main inducible duration inflammation, mediate pains and swelling. Whenever there is a pain produces, the main reason is for that COX-2 enzymes. When it is inducible during inflammation, only it activate at the time of the any infection or anything that just now told the cell membrane is ruptured, then only it is COX-2 enzymes is secreted and produces the prostaglandin. This is for that it is inducible during inflammation only. It is the mediate pain. This is the main reason for the pain. Now selective NSAIDs. Selective NSAIDs are the mainly inhibit COX-2. The selective COX-2, because the COX-2 is the main reason for the inflammation, for pain and swelling. So the selective NSAIDs are mainly selecting the COX-2. Now next one is the non-selective enzymes. It inhibit both COX-1 as well as COX-2. You know that we know COX-1 is a housekeeping as well as protecting the stomach, kidney, platelet. But here the non-selective NSAIDs, they are inhibiting both COX-1 as well as COX-2. Okay, like this, these are the meaning important terms for the NSAIDs. Next is the mechanism of actions. How these NSAIDs acts. The first of all, the act by the inhibiting COX-1 and COX-2 both result in prostaglandin reducing inflammation, pain receptors and fever. It means simple meaning it is there. The what it is doing, it is the COX-1. It blocks the COX for the production of the prostaglandin. Okay, just now acts inhibit COX-1, COX-2 or both resulting in the reducing the prostaglandin. If we block the COX-1 here, 1 as well as 2, if you block here, then the prostaglandin is not produces. After, if prostaglandin is not produces, then there is a no inflammation, pain, fever, redness, all that. There is a no symptoms arises here. The prostaglandin reduces inflammation, pain receptors as well as fever is also reduced. This is the mechanism of actions of the NSAIDs. Next, we will study the classification of the NSAIDs. The classification mainly we are dividing into 4 types: non-selective COX inhibitors, preferential COX-2 inhibitors, selective COX-2 inhibitors, and analgesic antipyretic with poor inflammatory action. One by one we will study. The first one is the non-selective COX inhibitor. Here there is no specific they are inhibiting the COX-2. It is not like that. There is randomly they are inhibiting. It may be COX-1 or COX-2. Like that, these drugs are inhibiting both COX-1 as well as COX-2. Those are aspirin, ibuprofen, mefenamic acid, diclofenac, and as well as aceclofenac. Like that, these group of the drugs, they are non-selective. They are without selecting COX-1, COX-2. They are inhibiting the here COX enzymes. That's why the prostaglandin is not produced. Next one is the preferential COX-2 inhibitor. Preferential means preferably their most chances are the COX-2 inhibiting. Just now I told the main reason for the inflammation is COX-2. The preferential, the COX-2 only inhibiting. Those drugs are nimoslides and meloxicams. Like that, these group of the drugs, they are preferably they are inhibiting COX-2. Very rarely the COX-1 also inhibiting in these groups of the drugs. The next one, selective COX-2 inhibitors. Selective COX-2 inhibitors means only they are selecting the COX-2 only. The COX-2 only selecting and inhibiting, like that blocking. The selective COX-2 inhibitors are celecoxib, atrocoxibs, and paroxibs. These drugs, the coxib drugs, are coming under these COX-2 inhibitors, selective COX-2 inhibitors. Next is the analgesic antipyretic. Analgesic antipyretic with poor anti-inflammatory actions. These drugs are also coming under the anti-inflammatory, but poor response it is there, poor anti-inflammatory actions it is there. You know, paracetamols and metamuzols, all these drugs are coming under the analgesic antipyretics. These four drugs there is the classification of the drugs in the NSAIDs classifications. Next one is the duration of action. Just now we studied the classification based on the COX inhibitors, based on the which one is a selective, which one is a non-selective, like that. Based on the COX we are classified the drugs. Now after the next classification is the duration of actions. The short acting, short period only the drugs is acting, based on that the short acting are ibuprofen, diclofenac, aspirin. These drugs are short acting. And next, long acting, that is pyraxicam, meloxicam. So these drugs, group of the drugs, they are long period of their show their actions. That's why they are considered as a long acting drugs. Okay. Next one, pharmacological actions. The pharmacological actions, these drugs are anti-inflammatory. This just now I told, analgesic, reduces pain, antipyretic, reduces fever, anti-platelet, and reduce uterine contractions. These are the main pharmacological action, these actions. Next is a therapeutical use. These drugs, in which diseases we are using? Mainly rheumatoid arthritis, osteoarthritis, fever, musculoskeletal pains, backaches, dysmenorrhea, like these gout, these diseases. In that these diseases we are using the NSAIDs. Okay, the next one is the adverse effect due to NSAIDs. Okay, adverse effect, first of all, the gastrointestinal gastritis, ulcer, bleeding. You know that COX-1 main function is the protection. Just now we discussed the COX-1, the protective housekeeping functions for the stomach layer. It is protecting. If you are giving these group of drugs, non-selective COX-2 inhibitors, then it will disturb its housekeeping functions of the COX-1. Due to that, the chances are there, NSAIDs, if patient takes the NSAIDs, then gastritis, ulcer, or bleeding the seen in the patients. Next one, renal. You know, just now I told the kidney, the COX-1 here, the COX-1 protect housekeeping, that is kidney also it is protecting. The here also renal, decreases the renal perfusion and nephrotoxicity due to the NSAIDs. Next one is the cardiovascular. The COX-2 inhibitors may chances of MI and strokes. We just now discussed these group of the drugs. If you are giving, the chances are there, selective COX-2 inhibitor, their adverse effect is it is a cardiovascular disease. It may produces if you give for long period of times. That is cardiovascular COX-2 inhibitor results the myocardial infarction or stroke. Next one, hypersensitivity. If you take the drugs, then it may chances are the rashes in the body or bronchospasm, breathlessness. These symptoms are commonly due to the aspirin or that drugs, ibuprofen drugs. Next one, hematological symptoms, increase the bleeding tendency due to these NSAIDs. Next, contraindications that in which we should not give the drugs. The peptic ulcer patient should not give the NSAIDs. Next, renal failure, kidney failure patients, bleeding disorder, aspirin in children's we should avoid, and last trimester of the pregnancy and some other cases also we have to avoid the NSAIDs. This is all about the today's class. Hope you understood. If you understood, please share to your friends.